Hello, Supply Side West. Welcome to the Supply Side stage. Great to have everyone with us here. We're going to be talking about something really important that potentially people don't really have an idea of is coming, but they are coming. Some of the most comprehensive reform in regulatory reform that we've seen in decades. I've got a couple slides here. I'm going to let our fantastic speakers get to that in a sec. Before we get to our program, we do have some show announcements here that might interest you, things that are happening tonight, other show information. If you click on that QR code, you can get a lot of exhibitor and event information. Just a little housekeeping there for everybody. First of all, I'm Duffy Hayes. I'm with Informa Markets. We are here to talk about MoCRA, the modernization of cosmetics regulation, the act that was recently passed but is coming soon in different phases. I've got the basics here of what we're talking about, but I'm going to let our fantastic speakers really drill down on this. We'll have a microphone in the audience as well, so if you guys have specific questions, raise your hand and we'll get to them a little bit after getting through all the slides here. But as you'll see here, you're looking at new FDA authorities are coming, records access, mandatory recall authority. You'll see registration, product listing. I know mandatory product listing is an issue that we're sort of dealing with on different levels and with supplements, and we've got some interesting, this is sort of an interesting prelude, I think, to that. And as you'll see here, initial compliance on certain things is coming in a few months. So I'm going to let our fantastic speakers get to the real nitty-gritty of those. Let's see. I did want to start with the other Duffy you might know in our industry, Duffy Mackay. He's more well-known. He spoke at Expo East quite passionately, actually, about MoCRA and what's coming. And you'll see here, I pulled some quotes that I thought were particularly notable, and especially this one about providing a sort of telegraphing for DSHEA reform. Obviously, DSHEA, it's been a long time since we've touched that critical legislation. And so, as he points out here in this next one, the products that we have today are significantly different. We're not just selling alcohol-based tinctures and vitamins. We have high-tech nanomaterials, 1,000 times bioavailability, complex mixtures, and synthetic ingredients. In short, it's a different animal than it was in 1994, and I don't think anyone would disagree with that. And his money quote was, "So now we have an industry where the stuff you put on your skin is more tightly regulated than the stuff we put in our mouth." That's really an amazing space we find ourselves in, and that's really why we're talking about it today and hopefully giving you guys the information you need. So we have fantastic speakers here. We have one of the great voices in our industry, Michael McGuffin with the American Herbal Products Association, and Ryan Severson, who's with Safety Call International. We're going to talk about adverse event reporting. So these are the top two guys we want to hear from today. I'm actually going to hand it over to Michael because he's going to drill down into a lot of the details. So Michael.
Thank you very much, Duffy. Thank you all for being here, and thank you for the opportunity. It sounds like Duffy Hayes got a hold of my slides because he just gave most of my presentation. And then I'm going to be so bold as to say I probably disagree with a bunch of what Duffy Mackay said there. It's not true that what we put in our mouth is less regulated than what we put on our skin. It's simply not true. And this idea of DSHEA reform, yeah, there are some changes that we need to get FDA out of the way as some areas in which they are obstructing consumer access to dietary supplements, which isn't my presentation today. So I'll move on to, again, this is a lot of what Duffy already mentioned. It's called MoCRA. It was enacted right at the end of last year, buried in a consolidated appropriations bill, the most significant change to the regulation of cosmetics in 85 years. A big deal, a really big deal. And it took a long time. It was a long time coming. This or similar legislation had been introduced pretty much perennially since at least 2013, I think actually a little earlier than that. It's always been Senators Feinstein, Democrat from California, and Susan Collins, a Republican from Maine, that have been the lead on this. But they really struggled to get to get it right. For many years, this bill would come out. It had the support of the Food and Drug Administration. It had support of the main trade associations, the Personal Care Products Council. It had support of the largest of the cosmetic companies and of an organization representing smaller cosmetic manufacturers. It had the support of the consumer protection nonprofit organizations. But it ran into a roadblock in 2014. The legislation was proceeding, and kind of at the last minute, Personal Care Products Council and another trade group wrote a letter to FDA and said, hey, how about this would be a good substitute? Let's do this law instead. I don't know how I got this in my computer, but I have a copy of the letter that FDA's Deputy Commissioner Michael Taylor sent to PCPC, to the Personal Care Products Council, in which he wrote to express his profound disappointment, that's a quote, that y'all are trying to change this midstream here. He said, and I quote, that the changes proposed by the industry creates the appearance of a modernized cosmetic regime, but a reality that actually prevents federal and state governments from protecting Americans from unsafe cosmetics. He said further, I have difficulty seeing a path forward in this process. We're going to stop wasting resources on it. This was a great opportunity. It's now an opportunity lost. It was the most terse letter that I have ever seen that made it into the public domain from the Food and Drug Administration. They were really angry. It was obvious that they felt blindsided. Now here we are, it's a decade later, and it's happened. And I'm pretty sure that MoCRA is awfully close to the version that FDA wanted and not to the substitute that the trade associations proposed in 2013. But so here are the new responsibilities. Some of these are going to sound very familiar. As Duffy already said, they're coming, right on us. They will come into effect, many of them, in just over 2 months. Facility registration, we all already know how to do that. We wish that the Congress had coordinated this with the facility registration that we all already have to do if we're manufacturing foods or dietary supplements, but they didn't. In fact, there's a 2-day difference in the date of required registration. FDA could have, we think, used its own authority to push that together so that if you're already a registered food facility, you would check a box, cosmetics, and check some details within. They didn't do that. You're going to have 2 separate registrations if you manufacture both foods or dietary supplements and cosmetics. I don't want to make a big deal of this. It's free. It takes 20 or 30 minutes, but it's something that you have to remember to do. And again, we already know how to do this. Product listing. This is a topic that's been under a lot of discussion in the dietary supplement industry for probably 5 years. And I think it's led to some unfortunate change in tone at FDA. They really want it, they haven't gotten it. And FDA's also using pretty terse language now when they talk to us and about us. It's never been all friendship and light, but still there does seem to be a bit of a shift, and I direct it to the attention on that and FDA's failure to get that. But the other thing that's important to remember here, and we'll get to this, the product listing will exempt the smallest companies. And if we do have to go back to dietary supplement product listing conversation, I know that the American Herbal Products Association would take the position that you have to exempt small companies. GMP, this detail is not as immediate. FDA has some time to propose a rule and then to finalize a rule. And if past is prologue, they'll give a staggered compliance time, and the smallest companies will have at least 2 years to come into compliance. We have to pay attention to this, because again, if past is prologue, FDA tends to issue GMP rules that are not entirely rational. You know what they don't do? They don't manufacture cosmetics. They don't manufacture dietary supplements, so we got 21 CFR 111 with all kinds of inaccuracies and inconsistencies in it, and we've learned to live with it, but we should have had a better outcome right at the beginning. Same with all those FSMA rules. What they don't do is make food, but they made the rules. And it is an open process, notice and comment rulemaking, but still I think we got to pay very close attention to this. And one thing that's come to my attention is that NSF has proposed that rather than go through all this rulemaking, FDA should save themselves resources and time and adopt the NSF ANSI standard for manufacturing of cosmetic products. We need to take a good hard look at that, but my guess is that that's going to be a very rational and functional GMP, and so I've talked to people at NSF just this morning about trying to look at that in some detail. We have to submit serious adverse event reports. Again, we've been doing that since 2006. We know how to do it. Ryan's going to talk about that in more detail. Labeling, this is also effective not in a few months, but at the end of next year, and that's fairly typical. The regulatory agencies know it's a bad idea to say, why don't you throw away a year's worth of labels? So we've got time to come into compliance, but it's time to start thinking about that as you do your label design. And there are these details here on the fragrance allergens that FDA's got to do a job first to identify what will need to be included on labeling there. And then this one issue about if you're selling to salons, if you're selling for professional use, you already have to have labeling at the end of this year. Safety substantiation, it's very original. It makes me uncomfortable, and then I'm going to be able to listen to Ryan, and I'm going to have great comfort at the end of his presentation about how reasonable and rational that will be for cosmetic companies. Right? FDA's new authority, mandatory recall, effective in 9 weeks. We already have that with dietary supplements. It's not problematic. What you know is if you've made a mistake that needs a recall, you don't wait to get the mandatory. You use the voluntary recall. It's really rare for companies to be non-cooperative. FDA has seldom had to use its mandatory recall for either foods or dietary supplements. Here's a surprising fact. They don't have mandatory recall for drugs. Let that sink in. Records inspection, they can see it now. The day that the law passed, they can walk into a cosmetic facility and want to see all of the records that will be required under this new law. The exemptions for small businesses, if your average sales in the last 3 years is under $1 million a year, you're exempt from the facility registration, from the product listing, and also from the GMP. Another little surprising detail, I was looking yesterday at FDA's guidance for small businesses in the cosmetic industry, and they make a good and clear point that you would be exempted from facility registration and that you would be exempted from product listing, but they didn't mention the exemption from GMP. I don't know if they ran out of type or they forgot, but again, I'll go back to why we need to pay attention. You know, the regulators love to regulate, and we'll continue to keep FDA on the straight and narrow as to what the congressional intent was. There are some exceptions which are listed here, certain classes of cosmetics that are considered at risk. And then here's a somewhat challenging question. We have a lot of member companies. They make things like herbal salves. It's olive oil, beeswax, and calendula flowers. Is that a cosmetic? I have to go through all of this registration and product listing and GMP, and we hope not. A lot of our members hope not. Or essential oils that are being sold for topical use. And so we just asked ourselves this question, is a topical product always a cosmetic? And here's the important words here. The first part of this is that it's applied topically, introduced, sprinkled, sprayed on, introduced into, or otherwise applied. But that next phrase is important for one of these purposes: cleansing, beautifying, promoting attractiveness, or altering the appearance. That's not what you use calendula salve for. It doesn't meet the definition. We really think that we can get to, and there's one member of the audience who has asked, I don't know, 7 times, 17 times, would you please produce the white paper? So we're working on that. We really do see that we need to take care of that. And then a related question, MoCRA created a new definition for a cosmetic product, which I think is messy, but they did. And so a cosmetic product means a preparation of cosmetic ingredients with a qualitatively or quantitatively set composition for use in a finished product. We wished it said for use in a finished cosmetic, because it would then be perfectly clear that those products don't meet the definition of a cosmetic. But we've looked at this, and we think that we still have a very clear rationale as to why essential oils, essential oil blends, simple herbal topical products could probably be argued as not having this law applied. If we had room for one more seat up here and the Food and Drug Administration was here, they would probably disagree with me on that. But we have to ask the question, we have to make the point, we have to try to keep, again, both the Congress and the FDA doing the job that they said they were going to do through the legislative process. I will turn it over to Ryan.
Thank you. All right, thank you so much, Michael, and thank you, Duffy, for having me. We're going to talk kind of the safety call perspective from a little bit more of a practical kind of housekeeping to-do list approach to dealing with the adverse event surveillance part of MoCRA. Just a little bit of context and background as to who Safety Call is. Some of you maybe are familiar, but Safety Call, we are an independent professional healthcare practice. We're unique in that we're triple licensed by the boards of medicine, pharmacy, and also veterinary medicine. Also unique in the fact that we provide our services for about 15 different industries. The common thread that has always connected them is product safety and oftentimes mandatory adverse event reporting. So that's where MoCRA is new. We've had companies in that cosmetic space for many years, but what MoCRA is doing now is just setting up, like I said, a kind of a housekeeping to-do list to look at your systems to make sure that things are in place to support what the FDA is going to expect and what MoCRA requires. So I kind of list out here just the kind of workflow when it comes to meeting the letter of the law. And we'll talk a little bit about the spirit of the law because it's much more than just doing what's required here. But I think it's good for any cosmetic companies or really any company with mandatory adverse event reporting to take a look and make sure that you're inventorying what you're doing back at home and making sure that these are being met. So it really starts with a process to receive adverse events. And Michael said, there's a bullet there talking about means of contact. It's required on labels now for cosmetics to have a way for consumers to report adverse events to you. So taking a look at that, that's really step one of it. There's some misconceptions there that that's all that's required when it comes to adverse event surveillance is just having the number there. But that's really step one of a pretty nuanced process to make sure that you're collecting good information, that you have standardized approaches for analyzing it, assessing it, reporting it. So the receiving is step one, really does lead into investigations. I think anyone that's had experience with adverse events know that they can tend to be pretty complicated. They require oftentimes medical expertise to get the right information. So investigating, knowing how to ask the right questions, collecting the kind of core data elements that are required is really an important part of it. Dovetails into the documentation. This is now required that records of adverse events need to be kept, both serious and non-serious. So having a standardized process to collect data is important. Assessment, that's part of what's there then required is not only are you capturing information about all adverse events, but you have a process to assess them for seriousness. And MoCRA sets forth the definitions of what they consider serious, most of which is pretty familiar because it's what's in existence now for supplements and for drug products. But of course they slip a couple things in there to make it a little challenging to deal with. New criteria that FDA would consider serious are reports of infection, and it's left as simple as that without a lot of context as to what an infection is or the severity level, as well as significant disfigurement. Again, somewhat subjective as to what exactly that means. So the assessment part is important, that you have an understanding of what the FDA's expectations are and that you're consistently assessing cases for reportability. And then obviously submitting and having to report directly to the FDA. A new thing for cosmetics, we always point out that there is a clock that is ticking that starts when you first hear of an adverse event or when a consumer calls or reports to you. The reporting window for serious adverse events is 15 days. It's what's already established for dietary supplements, but the clock's ticking all that while, so having a process to make sure that this can all be done effectively is really paramount. I always like to point out a few things, just kind of general principles when it comes to adverse event surveillance, just coming down first with the definition of what an adverse event is. It's any health-related event associated with the use of a product that's adverse. Pretty simple, common sense definition, but I always like to point out the fact that there are a few things built into that definition that are very much by design. The first being that an adverse event is any health-related event. So in the beginning, there's a expectation, a requirement to monitor all adverse events. It's not accounting for severity or seriousness in the beginning. It could be someone that reports itchy skin or someone that dies. Those are both adverse events and really need to be treated the same way in the beginning. And obviously, like I mentioned, there's an assessment process and different reportability thresholds. But all adverse events need to be captured. And again, we need to account for, we're actually putting aside severity in the beginning. As well as association. Adverse events, per the letter of the law, are events that are associated with the use of a product, and that means that there are allegations from consumers. The post-market side of adverse event surveillance is a little bit different because these are spontaneous reports from consumers. There's not necessarily a causal link that needs to be established for it to be considered an adverse event or considered reportable. So a frustrating part of adverse event surveillance, but that is part of it, that these are allegations from consumers, and you really need to put that causality piece aside there in the beginning. And then when it comes to reporting, we certainly kind of preach this to our clients, is just because you have an adverse event or something that needs to be reported, it's not an admission of guilt. It's really just following the letter of the law, the expectations from the FDA. We certainly preach, kind of going to the spirit of the law, that you do want to have more in-depth analysis, and I think it's important for any company to look at what's being reported from consumers. You're kind of following the passive reporting to the FDA, but you have a process to dig a little bit deeper, assign some level of causality, have some level of safety signaling to pick up on issues if they were to arise. But from a reporting standpoint, again, it's just part of the process. It's not proof that your product's the cause of it. And like I just said, the really adverse event surveillance as a whole is a passive allegation process to start, because that's following the letter of the law, but the spirit of the law is to have systems in place once you have good information that you can go through your assessment and analysis for your particular products. So kind of a to-do list here, just to take home, just to look at your systems if you are a cosmetic brand or really any brand. I think again, the requirements with MoCRA are not that dissimilar from what is already in place for supplements and other drug categories. So having a collection system that meets consumer expectations and internal needs. There's really a lot of stakeholders when it comes to adverse event surveillance. For us at Safety Call, it starts with consumers. They're reaching out to our clients for some level of assistance. They have an adverse experience or some health and safety concerns. So really the first stakeholder is making sure you have a process that really takes care of the consumer, because in a lot of ways, all of this is an extension of customer service in the beginning to make sure that your consumers are being looked after. But then that does obviously feed into what we talked about when it comes to adverse event processing. We always highlight training. That's an important thing. We've supported many of our clients when it comes to an FDA inspection, and when there are these requirements for surveillance from consumer complaints, the expectation is that any employee or anyone that is going to have interactions with a consumer understands what an adverse event is, understands what they need to do with it, hopefully is handing it off to their internal teams for the further review. But that's really where it starts, is having kind of a centralized understanding of what is an adverse event and what needs to happen when those reports come in. As I mentioned, adverse events, they're medical situations. Some of them are pretty straightforward that I think non-medical folks can get the right information, but oftentimes they are very nuanced. And especially with MoCRA, it is a new audience, and maybe different reports, and I'd always go back to the significant disfigurement. There's going to be lines of questionings that you need to be prepared for. I don't think adverse event surveillance can ever really be boiled down to a 10-list, checklist of questions to ask. They really are, conversations that need to be had with consumers, understanding what's being reported. A lot goes into kind of getting the full picture. And that's where having some level of medical expertise is important on the intake side, and that certainly feeds into then the assessment. The expectation is that there's reasonable medical judgment applied to determining seriousness. I didn't lay out all the different criteria, but one is for reportability is also interventions that would prevent a serious outcome. So it's not only what happened, but it's what could have happened. So having that clinical perspective, that medical expertise is an important thing to make sure you're kind of recognizing, identifying internally. And then again, this all kind of boils down to making sure these reports are getting to the FDA on time, and that clock is ticking back to when consumers are first reaching out. So having kind of, again, this kind of in-house inventory to make sure these systems are in place, because it needs to happen efficiently to make sure that compliance is there. I always kind of end with saying that this is all there to meet the requirements, but if you put aside the regulations, all of this is really the cornerstone of good product stewardship. So whether or not there's a FDA reporting component to it, having a process to hear from your consumers, hear of adverse events, get good quality information, have some level of assessment and review of those is really, again, the way you kind of establish the safety profile for your products and have a good feel for how they're performing. So with that, I think we have some time for questions and hand it back to Duffy.
Absolutely. If anyone has any questions, please raise your hand. I know some of this can be confusing. We've got a microphone over here. I guess I'll start with a question. Michael, there's a lot happening at FDA with Unified Foods Program and a lot happening. How would you categorize what's happening at FDA and how this is fitting into that new structure, I guess?
Well, FDA, right, they're undergoing reorganization, a self-imposed, self-requested evaluation of the working of the agency and their human foods program was very critical, and identified concerns about decision-making processes and leadership and just organization, and some places where there were redundancies and some places where the job wasn't being done. And I think that FDA has taken that report seriously, and one of the first things that they did is they moved the cosmetic whole category into the Office of the Chief Scientist. So they no longer included in the Human Foods Program. It never fit there very well. It had been ignored because there was no, the regulations were so minor. It was that you have to use inky names and kind of a couple of other things, but just not much. So now that they realize that they've got all of this new regulatory authority and regulatory enforcement responsibility, they have now moved that. We'll have to see how that fits. I've never before been familiar with what the office of the that science office does,
right.
But they seem to be taking it seriously.
Yeah, it's a different posture. I mean, this is decades in the making, though, isn't it? I mean, what changed, I guess, to get MoCRA through?
I don't know. I mean, I think that there is. I like to say, I've been dealing with regulators for a long time, and I think one way that my worldview is, there are more stop signs today than there were yesterday, because that's just what we do. We only move in the direction of more regulation, and so I think that's just, the gradual theme and process. I don't know what happened in the Congress that made it so that this legislation that has been strongly advocated for over a decade suddenly made it. I don't know what the circumstances were there, but here we are, and it's a tough and thorough and compliance applicable law. You're going to have, if you're in cosmetics business and you're not a very small business, you're going to have to deal with all of these.
How do you think some of the bigger companies are they ready for it? I mean, are they? I'm sure they've got capital to prepare for this.
Yeah, my guess is that the Estee Lauders and the L'Oreals and the Johnson & Johnson, they already do all of this.
Yeah.
They already been collecting adverse event reports. They've already got their safety reviews done. They're already manufacturing under. I mean, there's an interesting GMP was the term that I used, and I think that what we usually say is CGMP, current good manufacturing practice, and a lot of what current is what the big companies are already doing, and they're comparing notes, and they're, so I think that they should provide some leadership in the implementation of this law. I think the big companies will do fine. And then again, I did make that little comment about the herbal salves. Don't forget, most of those companies, many of those companies are going to have the small business exemption, but a lot of them aren't, because if you're a $5 million or $12 million herb company, even if your sales of the salves are only a couple $100,000, you're not going to get that exemption.
Right. And well, the personal care space is expanding too with new ingredients. Is that a complicating factor, or what do you think?
I think that's one of the factors that drove this legislation to go through, concerns about emerging new ingredients where there's no review process. FDA doesn't have a responsibility to evaluate for safety. And while the companies had a liability issue, there wasn't this very specific statutory language that said, you have to know that your product is safe. And we did see, I mean, as with kind of every product category, we saw cases where somebody used a hair color and then didn't have any hair, but instead had burns on his or her scalp. So I think there is a proliferation of new ingredients, and that's part of what drove this. Let me just make a quick add. APA's Botanical Personal Care Products Committee has been in existence for over a decade. We have a meeting scheduled sometime next month. This will be the topic. So feel free to contact me or any of the other APA staff that you see around, or come to our reception and talk to us there. 5:30, I forget the room. Mandalay, Las Vegas.
Excellent. Guys, thank you so much. We're clicking out of time here. Thank you for your presentation. Thank you all for being here. Have a great show.
Thanks
Appreciate
again,
it.
Duffy. Thank you.
Thank you.
Yeah.
All right. Thank you.